All right, am I recording? I believe so. Let me make my picture a little bit bigger. Let me start. Hello, Professor. Just a little disclaimer. This is my first time presenting using Zoom, but it's going to be a great presentation. Another disclaimer, I'm going to be basically teaching this PowerPoint as if it's a lecture or I'm teaching it to a group of students that don't know anything about breast cancer. So it's going to be a good presentation. I look forward to informing you or anyone who's watching this video. So let's get started. Good morning, everybody. My name is Kayla Colin. I'm a junior nursing student from Atlanta, Georgia, and today I will be talking to you all about breast cancer. All right, a little bit of background information about breast cancer. Breast cancer, in the simplest forms, is basically the uncontrollable growth of breast tissue. According to breastcancer.org, the term breast cancer refers to a malignant tumor that has developed from cells in the breast. When we say malignant, what does that mean? Some people don't know. You've heard malignant, you've heard benign. What does that actually mean? So a benign tumor is a tumor that is not cancerous. I wouldn't say it's okay, but it's not a cancerous tumor. And malignant is very cancerous tumor. It's actually pretty dangerous. The CDC mentions that about 250,000 women and around 3,200 men are diagnosed with breast cancer every year in the United States. Now, this is the part that really stood out to me. African American women. Did y'all hear that? African American women. Me, you, your grandma, your auntie, African American women die the most from breast cancer than any other race. That shows and highlights the importance of why we need to go get our mammograms when we come of age and different things like that. Just watch our health and be healthy because breast cancer is really affecting our community. So breast cancer usually begins in the lobes, the ducts, or the connective tissue in your breast. Breast cancer is also diagnosed in stages. It's based on how the cancer spreads throughout your body is how a stage of breast cancer is determined. So we have the stages range from 0 to 4 or 5, I believe. I believe it's IV. IV is 4. But below I have some pictures of breast cancer tumors right here. So you see it ranges from 2 centimeters, going up to 3 centimeters, 5 centimeters. That's just crazy how a tumor that size can be located in your breast. That's why it's important to analyze. We'll talk a little bit more about self-diagnosis and things further on in the presentation, but this just highlights the importance. Some signs and symptoms. So all of these are common symptoms associated with breast cancer, and this information came from the CDC. So if you find a new lump in your breast area or under your armpits, by just examining, checking, thickening or swollen parts of your breast. If you are not pregnant and you see that your breasts are swollen, hey, that's red flag, red flag, red flag. Irritation or dimpling in the breast skin, redness, flakiness in the nipple areas, pulling in of the nipple or pain around the nipple area, nipple discharge other than breast milk. So like I said earlier, if you were not pregnant and you were experiencing discharge or even a discharge of blood coming from your nipple, it's time to talk to your healthcare provider. All right, or any changes in the size and the shape of your breast or pain in the breast area. So like I said, if you were not pregnant and you were experiencing any of these symptoms, it's time to visit your primary care doctor. But I have also included a picture talking about the early diagnosis, nipple changes, bloody discharge, a lumping of the breast, change of breast color, breast pain. Those are some signs and symptoms. All right, some causes. The causes of breast cancer. Breast cancer is always caused by genetic abnormalities. So they're always caused by genetic abnormalities. Only 5 to 10 result from inherited abnormalities, but 85 to 90% come from genetic abnormalities and or the natural aging process of life. So just the everyday wear and tear on your breast throughout the year, childbirth and all the other things that have wear and tear on your breast. But like we said earlier, cancer is the uncontrollable growth of cells and cancer cells that tend to grow at a rate that is much higher than what healthy cells grow at. Researchers have found that hormonal lifestyle changes or like hormonal changes or lifestyle changes or just regular environmental factor changes can increase someone's overall risk of being diagnosed with breast cancer. Breast cancer is caused by a complex interaction, of your genetic makeup in your environment, according to MayoClinic.org. So there are so many causes of breast cancer, but mainly it's due to those cells that are constantly multiplying, and then the genetic abnormalities that come with it. All right, so let me go ahead and move my face. Molecular mechanics responsible for the disease. So responsible for breast cancer. Breast cancer is known to be a complex molecular disease on its own. The process involves an amount of, like you said again, the overgrowth of those bad cells that are just continuing to multiply. The overgrowth of the cell structures are listed as below. Just name a few: MAPK, P13K, AKT, or certain pathways as well. There are gene-altering structures, including oncogenes. I'm so sorry, but it's hard for the pronunciation. So oncogenes and genes for cell sins, such as D1 or E, that act as tumor suppressors. The molecular structure of breast cancer, this is the part that we really need to know. The molecular structure of breast cancer. Genes can be seen as BRCA1 or BRCA2. So, we've been talking about the causes of breast cancer and things of that nature. So now let's talk about treatment. Thankfully, the 21st century has opened a tremendous amount of doors when it comes to the treatment of breast cancer and how to improve someone's longevity life dealing with breast cancer. So we have so many different things that can fortunately help us or help cancer patients today. Excuse me, I'm just so tongue-tied. Let's first start off with surgery. So one surgery that a lot of us know about is a mastectomy, which is, of course, when a woman decides to either chop off one breast or both breasts due to them being in a cancerous state, so that, like we said, those stages, so that the cancer doesn't spread throughout the rest of their body. So they go ahead and they make that strong decision to just say, hey, I do not want the cancer to spread throughout my body, so I'm just going to go ahead and get my breasts cut off so that the cancer will not spread. The lumpectomy is also some things, or a lymph node dissection is another type of surgery that they may do. Another common source of treatment would be radiation. So high levels of energy is used to kill cancer cells, and the cancer cells are shrunk. That's a method that people use, but radiation has so many side effects. I actually had a grandmother who went through radiation for her form of cancer, and radiation burned her so very bad. It was really tough seeing someone disintegrate from radiation, because one thing about radiation, it doesn't just kill the good cells, it kills the bad cells, it kills everything and all things, and that's the downside to radiation. But you also have hormonal therapy. This is a medical treatment used to lower or block the hormone estrogen in the body, to hopefully help combat breast cancer. And then you also have chemotherapy, which also is a I believe they inject with chemotherapy. It's a treatment used to weaken and destroy cancer cells. So these are all the treatment approaches that they have. But with the amazing technology that we have today, things continue to advance, continue to move forward. So we hope to even have even more treatment plans or no cancer at all in the near future, if we're being honest. But I've gone ahead and inserted a photo. So as you can see, surgery is an option, hormonal therapy, radiation therapy, chemotherapy, all things that can help combat the spread of breast cancer. Techniques used to diagnose. We've talked about the treatments, we talked about the causes. Let's talk about how do you find out that you have breast cancer? Like, what's the diagnoses? So there are many techniques that are used in the medical field today with breast cancer. Some techniques can even be done at home with the patient themselves. Let's go ahead and start with the mammogram. So as you can see the diagram at the bottom, what to expect during a mammogram. So fill out a pre-test questionnaire. Each breast is compressed horizontally between two plates for imaging, and then just like this, and then the plates are turned sideways and also compressed. So I remember being a student shadowing at the hospital. I witnessed women who would come in for a mammogram, and it's literally a machine, and they place their breast on the machine, and the machine does exactly what this picture does. And it flattens the breast so that we can see the tissues in the breast to make sure there's no lumps or anything like that. And a little fun fact, if you actually have breast implants, you want to notify the person that's giving you your mammogram, because look at how that thing is pressed down. Like, if you have breast implants, they may just pop. So that's why you have to notify the person that you have not you have breast cancer, that you have breast implants during your mammogram. Also, you have MRIs, ultrasounds, a clinical breast exam where you can go into your doctor's office and they'll, give you a breast exam, look for lumps, look for different things like that. Also, you can do a self check at home. Now we have so many YouTube videos that can show you what to do and different things like that. A little bit going back to my shadowing, I actually worked in the breast center, so I've seen all of this firsthand. And a fun story, keeping it within HIPAA, not a fun story, but I remember this lady who was in remission. She came into the breast center to get her monthly ultrasound check of her breast, and all you saw was huge white black lumps on her ultrasound, and she was in distraught because she kind of knew what it was already. She knew what was going on, and it was a very sad moment because the ultrasound tech and the radiologist, we had to keep it calm and composed in the room, but once we left, they were like, yeah, it's back. Her breast cancer is back. And it was really devastating to see somebody, come out of battling something like this and for it to come back in the way that it did. But this just highlights the importance of going to go get your mammogram, to go to the doctor's office whenever you see anything off about your breast or your body. It's very important. You know your body better than anyone. But recent research advances in the field, we're going to talk about nano drug delivery system. I read an article, and it basically talked about, let me go ahead and move my picture. Can I make it smaller? All right. So it basically talked about research being conducted by the Department of Pharmacy and a university in China over Chinese medicine. And the journal entry was just talking about this new drug, the nano drug delivery. It was a different way to comprise nanoparticles, nanocapsules, liposomes in this drug that would help combat breast cancer. The advantages, it would directly, properly target a tumor. Instead of targeting all cells in the body, it would just target the tumor. It was a high bioavailability. There was reduced side effects. So no more fatigue, no more you feeling awful after going through these different treatments. And there was a huge increase in drug availability. with the nano drug system delivery, because this drug induces tumor killing properties. This type of drug became a research hotspot across the world. And, if it could help women and men combat breast cancer, it's what we need. Below, I have inserted a picture of a few of the things that they use within the nano drug delivery to help with this process of treatment. And to finish things off, how does the topic relate to the course? So this topic relates to the course, relates to the chapter by chapter 27. So chapter 27 covers all aspects of female health, and I absolutely love reading this chapter because I would love to work in women's health or work in labor and delivery. So the amazing things that a woman's body can do is very interesting to me, and I'm happy that I got to cover this chapter. But breasts are a huge part of the female reproductive system because they provide milk to our offsprings. So throughout this chapter, we just covered how the breasts start to grow, beginning through puberty, how the breast changes in its function versus when you're pregnant versus when you're not pregnant. The body can do so many amazing things. And breast cancer just was a disease that stuck out to me because it's affected so many people. Breast cancer, wow. I just wanted to highlight more in depth about the research that goes into breast cancer, about how society really talks about it and how it's affected so many people. We've dedicated an entire month to breast cancer awareness month in October, of course. And I just wanted to learn more about this disease myself, the process, the treatments, the current studies that are going on with it. And I've learned so much about breast cancer due to this project. And I'm so grateful that, hopefully if I ever go back to breast center or anything of that nature when I go to the hospital, that I will be prepared and I will know more than what I've ever known. And I just really do appreciate this course, Professor. And I hope that you've enjoyed my presentation. So we're going to go ahead and end it with my slides. I have a couple of websites on there, but I also do have 2 articles that I read about breast cancer, about the studies of nano drugs and things of that nature. And I had an amazing time in your course, and you have a good day. Thank you.